2009 has already become a watershed year for us. We have a new president, we have a new Congress, and we have a huge agenda in terms of healthcare reform. That mission for us is to protect those who we care for on a daily basis, the elderly, the disabled.
Now is the time to deliver on health care. Now is the season for action. Now is when we must bring the best ideas of both parties together and show the American people that we can still do what we were sent here to
do. As we look for ways to improve the entire spectrum of care for Americans over their lifetime, protecting and improving long-term care is essential.
If we all pull together, we all understand the commonweal value of pulling together as a nation, that we will indeed enact health care reform that is vital to the continued future and success of Medicare and Medicaid.
We absolutely understand the urgent role we play in the healthcare reform process.
We have even gone to the expense of putting together a very detailed long-term care reform proposal that will actually save the government money.
Healthcare reform is just as important to assisted living, and our proposal includes assisted living.
Never have I seen the challenges before us that we have today. Healthcare reform, Medicare cuts, Medicaid cuts. At the same time, we see the need for continuation of our improvement in quality. It is you, members of AHCA and NCAL, that have answered the call in these challenging times.
We all know why we are here today. We are alarmed by the Medicare cuts to long-term care that is currently in the House of Representatives.
The importance that Medicare funding has for the seniors of America, that if it's cut, does have a very negative impact on nursing homes throughout the United States.
In long-term care, Medicare cuts are magnified by chronic Medicaid underfunding.
I get really emotional about the impact that our politicians are trying to have on the most frail, our elderly.
I'm hard-pressed to understand how cutting Medicare funds to skilled nursing care by $44 billion nationally over the next 10 years is going to make better or improve the care we provide.
Live locally.
According to a poll released today by the American Healthcare Association, Americans strongly oppose cutting Medicare-funded nursing home care.
Nursing homes in Michigan may face nearly $1.5 billion in funding cuts.
Salisbury senior citizens aren't the only ones concerned about a proposed cut to Medicare. Today, Congressman Frank Cradaville sat down with administrators and doctors who work with elderly patients to hear their concerns.
Hundreds signed a petition urging New Mexico legislators to stop severe Medicare cuts.
The petition is part of a campaign by the Coalition to Protect Senior Care.
Potential Medicare cuts in Florida could cost seniors $3.5 billion during the next 10 years.
The American Healthcare Association claims Nevada could lose close to $185 million in Medicare reimbursements to nursing home care.
Our key is to getting adequate funding and be able to take care of the people in the way they deserve to be taken care of.
This association goes to work every day on our members' behalf to fight the battle, to create a fair environment for us to operate in.
We have the opportunity to have an influence on shaping care in the future for the frail and elderly in America.
AHCA is the voice of the long-term care industry. They unite us and they bring that message of quality care to the legislature, and they definitely influence what we can provide for the elderly community.
We want to continue to provide as high quality as we can every single day, 7 days a week, 365 days a year.
We meet so many people that need us, that have outlived their family members, who have outlived their income and their resources. Those people have to have an advocate, someone who will fight for them, so they have a living that has quality to it.
When I look back on our past successes, we are best when we work together and we're unified. In this period of time of historic challenges, it is very important we work together as a team. Everybody has a part, everybody has a role. When we work together, we win together.